Hey everyone, I'm Taylor Wardwell. I'm one of the doctors at All Pet Complex. And today I wanted to talk about something that is kind of a soapbox issue for me, and that is mitral valve disease in small breed dogs. It's a very common condition, and it's very over treated, and it drives me nuts. And so that's why the title of this video is why I take more dogs off of heart meds than I start on them, because I so frequently see dogs come in on meds that just are not necessary at all. So anyway, what are we talking about? We're talking about a condition that is very common in small breed dogs, that causes a leak in one of the valves of the heart called the mitral valve. And we call it myxomatous mitral valve disease, or MMVD. I just usually refer to it as mitral disease. And specifically, we're talking in smaller breed dogs, like less than 15 kilos or so. Um, and in those dogs, these things all generally apply. In larger dogs, or in some certain breeds, um, we're concerned about different types of heart disease, or even this type of heart disease has a different likely disease course in those breeds. So this is for sure a certain specific subset, but very, very relevant and very, very common in that subset of dogs. So the classic example would be like an older small breed, like say an old Chihuahua, or an older Yorkie or something like that. And they might come into your clinic with a moderate heart murmur, like say a grade 3 out of 6 heart murmur and a cough. And or maybe they come in already on heart meds, pimobendin, um, or vetmedin, and furosemide or Lasix. Um, most of the time when I see that dog, those drugs are not necessary. So if you see a small breed dog with a left-sided apical heart murmur, um, what disease process is going on? 99.99% of the time, it's mitral disease. So what we know already about that patient then is that about 70% of those dogs are never going to develop any clinical disease from that heart condition. They're never going to know they're sick and thus never need to be on any medications. Um, we know that if their respiration rate in the exam room is less than about 30, then they're not in heart failure. There's just no way they're breathing that slow in an exam room where they should be stressed, and have a well within normal respiration rate. So that dog's not in heart failure. If their heart rate is less than about 120 in the exam room, again, definitely not in heart failure. They just, again, no way that a heart that's struggling to keep the hemodynamic stability is not going to be racing along, especially in that situation where the dog is probably stressed. Also, if there's a sinus arrhythmia, not in heart failure. A heart that's in failure is not going to be responding to any stimulus saying, slow down or speed up in accordance with the breathing. It's just pumping away as hard as it can, as fast as it can. So those are things that we already know about that dog that just came in. So what should we do? Well, what I would say is what you shouldn't do is send it immediately for an echo, but we'll get to that. What you should first do is grade the murmur. So you can grade them either soft, medium, or loud. There's a pretty easy grading scheme, or you can grade them on the number grading scheme, a 1 through 6 grading scheme. That's generally what I do, but really my decision making comes down to whether it's soft or loud. I just use the numbers because I think that's a little bit more of a sensitive way to communicate it to other doctors and to myself. But you have to be somewhat objective about how you use those numbers, and I have lots of opinions about that also, and they're not mine. I just, but I'll say that for a different video. So anyway, if you have a soft murmur, that's the sounds are quieter than the normal heart sound. So it's like do 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 do, versus a medium murmur where the murmur sounds are about as loud as the heart sounds. So it's a and then you have the super loud murmurs where it's just like and we've all heard those. And sometimes they have a palpable thrill. You can actually feel the murmur. So you've got soft, medium, loud. So what do you do if you hear a dog's with a soft heart murmur? You do nothing. You take an X-ray, or actually in a soft murmur, excuse me, you do nothing. You listen again next year because that heart is not enlarged. Dogs with mitral valve disease do not get big hearts with a soft murmur. And so you just check again next year. And if they have a louder murmur next year, then we might change our plan. So let's say they come in next year. Now they've got a medium heart murmur. Medium murmur, you should take an X-ray because a medium murmur could mean zero heart enlargement, or it could mean extraordinarily enlarged and on the verge of or in failure. Usually those failure dogs have a really loud murmur, but they don't have to. So medium murmur, take an X-ray, look for heart enlargement. And specifically, you want to look for a left atrium that you can see on the VD, so a big white spot that you can see over kind of the more caudal aspect of the heart silhouette on the VD. And if that's there, then you have at least moderate enlargement, and then that might very well warrant taking next steps for medication. If there's no enlargement, then you just recheck again in like a year or 6 months, whatever you're comfortable with, but take another X-ray in 6 months to a year, because that dog with no or mild enlargement isn't going into heart failure anytime soon, at least not in that population of dog. So if there is moderate to marked enlargement, then we're going to start them on pemobindin and start monitoring their sleeping respiration rate. And we'll get into that a little bit more in a minute, but that's the trigger to start pemobindin. Their heart needs to be at least moderately enlarged, and then you're going to start pemobindin. And why is that? What about the EPIC study? And I'll talk about that a little bit more. But the EPIC study said any dog in stage B2, so any dog with some degree of heart enlargement, needs to be on pemobindin or can benefit from being on pemobindin. Well, really the point of pemobindin is to help protect the heart, slow its progression into failure, and give it improved function when it's nearing or in heart failure. Dogs that have no significant enlargement, again, 70% of those dogs are not going to go into heart failure. So if there's no real significant enlargement and they're not showing that they might be one of those dogs that goes into failure, you might very well be putting them on a medication that costs $1,000 a year and provides no benefit and might cause harm. There's some suggestion on some studies that putting dogs on pemobindin long-term that don't need it might result in actually causing problems in the heart, and maybe even result in sudden death. So, I don't know that we've pinpointed that definitively yet, but mostly I don't want to waste my clients' money and put my patients on meds that they don't need, but also maybe there's some risk there. So what about if there's edema on the rads? Well, I would consider rethinking whether or not there is edema on the rads. Think about if they seem clinical for heart failure. Is the respiration rate less than 30 in the room? They're not in failure. Is their heart rate less than 120 in the room? They're not in failure. If they have increased respiration rate and increased effort, if you walk in and you go, oh crap, this is a dog that's in heart failure, by all means, treat for heart failure. Give Lasix to effect. I don't care what chart you read or whatever protocol you're going off of. Give 1 to 2 mg per kg every hour or whatever. You give it to effect. You just blast them. The last little dog I had in with heart failure, I think I gave them 20 mgs per kg over the course, total daily dose over the course of several hours. That well exceeds the 8 mgs per kg or something that is generally recommended. But who cares about your kidneys if you can't breathe? You need to save that dog. So don't be shy. Use the Lasix, blast them, get them out of failure, and then find the lowest effective dose. If you're not sure if there's edema, but they don't look like they're dying that second, use the best, most sensitive monitoring tool you can to diagnose edema, and it's the sleeping respiration rate. And there's some good forms out there that are available that you can send clients home with, or you can make your own. But basically, their respiration rate should be in the low 20s or below 20 when they're sleeping. And I always say to clients, when you see your dog sleeping over there in the corner and you go, wait a minute, you still alive? Ah, there you go. That's a normal respiration rate. If they're sitting there sleeping and they're not dreaming and kicking their legs and chasing a squirrel, but if they're sitting there dead asleep and going, that's not normal. That's a really good sign that there's fluid building up on the lungs. That's a dog that's probably in congestive heart failure. We should start that dog on Lasix. And it's a very good way to monitor your patients that are on Lasix, because their respiration rate is going to increase as their heart failure worsens and the current Lasix dose is not enough. So I encourage all of my clients to use that to check for the presence of failure and to monitor for how our treatment is going. I wouldn't necessarily encourage any client with a dog with a heart murmur to start counting the respiration rate unless you really think failure is imminent, because otherwise they're just going to be burnt out in no time because their dog might never go into failure. So what about the EPIC study that says we should be giving this pimobindin to all dogs in B2? Well, that study kind of sucked. The data regarding specifically which dogs had which changes to their heart, so who had the more significant disease at the beginning of the study, and which of those dogs ended up reaching the end point, aka dying from congestive heart failure, that data isn't available. And so really making a determination as to which dogs it helped and which it didn't is really hard. And when you look at the survival curves, you have some dogs that die off relatively quickly, but after about day 300, which is more or less the average survival time for dogs in failure that are being treated anyway, the survival curves are pretty much parallel. So really there's no noticeable benefit in how fast those populations drop off between the I'm on pimobindin early and I'm not on pimobindin early, because a significant portion of those dogs just don't go into failure. And so really what it showed, without meaning to show it, is that there's probably really no benefit in starting that drug until the appropriate time, which is at least moderate heart enlargement. What about ACE inhibitors? I haven't said anything about put this dog on enalapril or benazepril. What about those? We're supposed to use those. Everyone uses those. They're trash. Throw them away. Don't use ACE inhibitors. I never use ACE inhibitors, really, for pretty much anything. They're worthless for blood pressure. You can get about 5 points down on a dog with an ACE inhibitor. So they're worthless for blood pressure. Use amlodipine if you really have a hypertensive dog. There's no evidence that they really provide any benefit in mitral disease or congestive heart failure. And while some people still recommend them, it's probably because they did a lot of research on them and published those papers, and it was a significant part of their career, and now they're on advisory boards and it's really hard for them to let go. But there hasn't been a consensus statement that could be agreed upon on ACE inhibitors from the cardiologists, because half of them are probably younger and saying, yeah, these things are worthless, and half of them probably have, at least some emotional investment in those medications. So anyway, ACE inhibitors, pretty much worthless. I also, for the record, don't really use them for protein-losing nephropathy. I might start a dog on them if they really have a mild PLN, but really the angiotensin receptor blockers are way better. And you can take a dog from like a 7 on a UPC down to like 0.2. If you can make them normal using the ARBs, and the ACE inhibitors are worthless. So maybe not completely worthless for that, but really not nearly as good. So anyway, I don't really use ACE inhibitors for most things, but definitely I don't use them for mitral disease. So what about the cough? This dog comes in, it's got a heart murmur, it's got a cough, it's in heart failure, right? Most dogs in heart failure don't have a cough, or if they do, it's like this, oh crap, that's a heart failure cough. They're like hacking up fluid and stuff, and it's not that little dry hacking or honking cough or whatever that you see these little old dogs come in with all the time. Those dogs probably have like collapsing trachea or collapsing bronchi or bronchioles, or they've got like chronic bronchitis or something. They've got some sort of airway disease and not congestive heart failure. And so all the more reason to take an x-ray on those dogs. Then you can confirm that, oh yeah, look, you've got main stem bronchi collapse. Put this dog on some pred and some codeine, or something that can help with the inflammation and the cough and whatnot, but it doesn't need to be on pimobendan and Lasix probably. But what about the dog that came in with the cough, and the doc put them on pimobendan and Lasix, and that cough got way better? So it must have been congestive heart failure, right? Well, Lasix has some antitussive properties too, so probably the Lasix was helping, just not doing what the doctor thought it was doing. And just, you can put them on a really, really, really low dose of Lasix and have an improvement in the cough because of the antitussive properties. So, I prefer to put them on something different, but if they're already on it and you want to keep them on a super low dose, then great. I've had plenty of dogs that do fine with that. But another clue that you could see sometimes on these dogs, I'll have dogs that come in, they just moved from somewhere else and they need to get established so they can refill their pimobendan and their Lasix. And then I have this very conversation with them about, hey, yeah, I'd love to refill your dog's meds, but maybe we should talk about that, because maybe we don't need to do that. Maybe we'll be, once again, taking another dog off of heart meds that it doesn't need. And I start questioning them, and how long have you been on these medications? Oh, let's see, I guess it's been about 4 years. That dog is not in heart failure, or at least it wasn't when those meds were started, because those dogs live like a year if you're lucky. So the dog that's been on furosemide for 4 years, it hasn't been on it for heart failure, that's for sure. So, that's what I think about the cough and Lasix helping with the cough. What about echo, though? These dogs have a heart murmur, they have heart disease for sure, and we can definitely find things on the echo. We can measure their chamber sizes, we can look for regurgitation. Maybe there's some tricuspid regurg too. Oh no, there always is. And if there is, how does that change your plan? It doesn't matter. We know what the disease process is. That's why we do the echo, to see what disease processes are there so we can treat accordingly. We know that they have mitral disease, so how does that change anything? We go, oh, they're B2. Well, is the left atrium super enlarged or just a little? Well, then I'm probably not going to start it on pimobendan if it's just a little. And if it's really big, yeah, I probably could have identified that on x-rays. So, what does the echo do for us? Usually not a lot, so I don't send all of them for echoes. There are some exceptions. If you're concerned about pulmonary hypertension, like the dog has syncope or it has really bad failure and you want to make sure you're not missing some secondary component that you can be treating, by all means, do an echo. That's a great way to check for pulmonary hypertension. Or if you see evidence on the x-rays of some, big congested pulmonary vessels that are kind of tortuous or whatnot, yeah, those are that's a good reason to do an echo. Or if it's, not a dog that always reads the textbook like a cocker, that, cocker spaniel might have DCM. So do an echo on that dog, because you don't want to be, oh, it's no big deal, and then they die from DCM, which is a bummer anyway. You're not going to be able to do a ton for that, but you should know what disease process you're dealing with, and that's a case where you don't know. Some dogs, conformation can make interpretation of the x-rays difficult, and sometimes even if you send it to a radiologist. I recently had a patient, it was a patient just like this that came in from out of state, had been on pimobendan and Lasix for a long time. I told them they probably or may not need it. Turns out they'd been on it for several years. And so we went and took an x-ray, and I'm pretty sure that heart's normal, but man, it sure looks big in that chest. It's, it's probably just the dog's conformation. So I sent it off to one of my colleagues and said, hey, what do you think about this heart? She said, it's not or maybe mildly enlarged. I definitely don't see any evidence of edema, but the conformation does make it a little weird. You could try, getting this one view is a little bit oblique. You could try getting a little bit straighter, but I don't think that's going to make a difference. This is a dog, if you're really concerned, you might echo because its conformation is going to be hard to tell if there's enlargement on an x-ray. So, those are indications. And then if it's just not following, the clinical picture that you expect, something's not right. It was in last week, and the murmur was a grade 3. They come back for a recheck because the dog seems off, and the murmur's now like a 6. Oh geez, did they rupture a chordate tendineae or something? There's reasons to do an echo for sure, but you shouldn't just send every dog with mitral disease for an echo. It just wastes the client's money, wastes your radiologist's time. They're a boring study. Give them the cool cases. I love seeing an echo that's interesting. So in any case, those are the dogs that I will echo. So I guess, what are our bottom lines? What are the big takeaways? Big takeaway is, until a murmur is at least medium/grade 3, we do nothing. Once it's at least medium or grade 3, then we take x-rays. And if there's no significant enlargement, we just take x-rays routinely every 6 to 12 months, whatever you're comfortable with. I usually do a year unless things are really getting close. And you look for cardiomegaly. When there's cardiomegaly, at least moderate, then you start them on pimobendan. If you think that they're close to developing congestive heart failure, or you think that they might be in congestive heart failure, then we start monitoring the sleeping respiration rate. Once the sleeping respiration rate confirms that there is failure, then we start them on Lasix, and we basically dose the Lasix to the minimum effective dose. And we use the sleeping respiration rate to monitor the efficacy of our dose, and we adjust accordingly. And finally, you should throw away your enalapril and stop sending every heart murmur in a small dog for an echo. And you should stop treating every cough in a small dog with a heart murmur as heart failure. Those dogs probably have respiratory disease. So anyway, looks like my animals are getting restless. And I think I've hit all the points that are important to me. It's just, this is an important topic because it's a very common disease, but it's also very commonly over-treated. And I don't think that's fair to our clients. I don't think it's fair to our patients, and I just don't think it's good medicine. And so in any case, those are my thoughts and opinions and the information I have about mitral disease in small dogs. Feel free to comment below. Send me your questions if you have any. If there's other topics you'd like us to cover, let me know. I'd be happy to do it. I have plenty in the works. And don't forget to like and subscribe if you like this video, and follow us on YouTube, and we will see you for the next one. Thanks.